Well, I'm here in Norwich talking to bus drivers and passengers because we've just put in £46 million long-term funding for Norfolk to use on buses. Here they're adding to their electric fleet, and so this bus is electric, very, very popular, and also popular is the £3 fare. You can see the cap on fares. So in a rural place in particular, it makes such a difference to have a really good bus service. So putting extra money in, long-term funding, £3 cap so that people know where they stand with the fares, and investing in the buses of the future. Hugely popular, meeting the bus drivers here. Many of them either starting as apprentices, some of them been here 30 or 40 years, and then some of the passengers who are very, very keen on the £3 capped fare. No, we do need to make progress, and what President Trump wants, what Ukraine wants, what Europeans want is the same thing, which is a just and lasting peace in Ukraine after the nearly 4-year aggression from Putin and Russia. So we're working towards that aim. Obviously there are a number of issues still to be resolved, but I'm very clear in my mind that we support Ukraine in this fight, not of their making. They've paid a very heavy price. If there is to be a ceasefire, and I hope there is, and Ukrainians want that above all else, it must be just and it must be lasting. We've had ceasefires in the past, which Putin has then breached because they weren't robust enough, and we're determined to make sure that any peace is a lasting peace.
Back here, statistics this morning show record numbers of patients in hospital with the flu. How concerned are you by those figures? Does the government need to step in and advise face coverings on public transport?
Well, I think as far as the flu is concerned, there's a winter plan in place, and I had a briefing on that the day before last in terms of the robustness of the plan. I want to thank all the NHS staff who always step up during the winter period to deal with flu or whatever else. We do need to take precautions. There's no difference in the guidance, so we're not changing the guidance on face masks, but the usual things about ventilation, washing hands, and just being careful when you're around people who are vulnerable is the guidance. It's common sense, and I think most people would want to behave in that way.
And do you agree with the Health Secretary yesterday that resident doctors could ruin people's Christmases if the strikes go ahead?
I'm very concerned with the action of the BMA. They are being irresponsible in my view. We have already put in place quite a significant pay rise. There are other issues that they're concerned about, which we've been listening to, and we put an offer on the table to deal with those issues. But that offer can only go forward if they don't take strike action, particularly in the run-up to Christmas, particularly when we've got a problem with flu. It would be irresponsible of BMA to push through. And I think for many resident doctors, I think in their heart of hearts, they probably don't want to do this. So I'd just say to the BMA, do the responsible thing, accept the offer that's on the table, and we can all move forward, because at the moment this is a challenge not only to the winter, but also the good work we've done in bringing down waiting times, which is in everybody's interests.
Patients waiting for days and days, ECGs being done in toilets, one man dying on a trolley in a corridor. This is happening on your watch. You said you'd turn around the NHS. That feels a long way on, doesn't it?
Well, these are very concerning histories, and we absolutely need to bear down on that. Nobody wants to see those conditions or patients dealt with in that way. We have invested hugely in the NHS, the biggest investment in the budget that's ever been put into the NHS. NHS was brought pretty much to its knees by the last government. We are turning that around, getting the waiting list down, the ambulance times are coming down. It will take time to turn this around, but I'm not going to stand here and pretend that this is acceptable. We have to tackle it, and we're doing everything we can to do so.
Off by now.
Well, it is a problem we should have got on top of, and we're bearing down on it. And I have regular meetings with the Health Secretary and his team to look at these issues and ask the questions about can we go further and faster, and how do we get trust to respond to what we're asking. We are putting a huge investment in. We are bringing waiting times down. That is a good thing, and I thank all the NHS staff who are helping us with that. Ambulance times are coming down, so we're turning this ship around, but it's a big ship to turn around. 14 years of underinvestment, bringing the NHS to its knees, which is what happened under the last government. We're turning that around, and we will get it right, but it's taking time.